Hi, let's talk about head tilt in canines. Head tilt is a postural deficit of the head and neck and is most commonly caused by an abnormality of the vestibular system. The head is twisted to one side on its long axis so that one ear is lower than the other. This is called a roll. It should be distinguished from a turning of the head and neck, where the head remains parallel to the ground, a yaw, which is usually caused by spasms of the cervical muscles or by brain stem disease. To help distinguish between these two head posture changes, it is useful to observe the patient's head from straight in front or by viewing the head from above. Animals with head tilt due to vestibular disease frequently have asymmetric ataxia and nystagmus. Animals with acute external or middle ear disease may tilt their head toward the affected side. In these patients though, there are no signs of ataxia. Facial nerve dysfunction or Horner's syndrome may be present if middle ear disease is causing the head tilt, but there will be no vestibular signs or other neurologic deficits in this instance. So although vestibular disease is by far the most common cause of head tilt, the clinician should understand that it is not an exclusive vestibular sign. Head tilt is caused by an imbalance of tone in the cervical spinal muscles, which are controlled in part by the vestibular system. The vestibular system includes the receptors in the inner ear, which detect changes in position of the head with respect to gravity and acceleration of the head, the vestibular nerve, the vestibular nuclei in the brain stem of the cerebellum, and ascending and descending sensory pathways for the recognition of trunk, limb, and head position. Lesions of any part of the vestibular system produce one or more of the following signs: head tilt, usually to the side of the lesion; ataxia, which is usually asymmetric, falling, leaning, veering, or rolling to the side of the lesion; and different forms of nystagmus. Differentiation of central lesions from peripheral lesions is essential for management and prognosis. As a general rule, diseases that result in central vestibular signs carry a far worse prognosis than those that cause peripheral vestibular signs. The most useful distinction is the presence of postural test reaction deficits or motor weakness, which are seen with central disease but not with peripheral vestibular disease. Most peripheral vestibular syndromes are caused by inflammation, infection of the inner ear, or are idiopathic in nature. Central vestibular disease may be caused by a variety of disorders. The history provides information on the rate of onset, course, previous illness, age, and previous medication. Peripheral vestibular disease usually has more favorable outcome than central disease. Most animals with idiopathic disease recover fully in several weeks, with or without treatment. Many central diseases are progressive disorders that are unresponsive to treatment. Some central syndromes with an acute, non-progressive history recover with little deficit. It is possible that these are due to vascular lesions or infarcts that resolve with time.